Hello, I'm Julie Trocchio with the Catholic Health Association of the United States. CHA and its members recognize the impact the healthcare sector has on the environment. Together, we are committed as health professionals to first do no harm. As Catholic ministries to care for the sick, the vulnerable, the unborn, and all of creation. And as neighbors, to act in the best interest of our communities. We show our respect for the Creator by stewardship of creation. Care for the earth is not just a slogan or something we say. It's an important part of our mission because serving people, protecting our environment, and living our faith in relationship with all of God's creation is our calling. CHA has a history of advocating for environmental stewardship and for programs to reduce pollution and decrease the carbon footprint of healthcare. In 2008, we joined with our members to bring the ministry's collective work under an initiative we called Faithfully Healing the Earth. With some grant funds from the Catholic Climate Covenant, we began to build the case for why we, as Catholic organizations, have a moral responsibility to care for creation and to address climate change. To develop materials on climate change and pollution, we've assembled a faculty of experts available to mentor facilities motivated to be more sustainable and to decrease energy use and emissions. We collaborate with other organizations to build consensus and to replicate successful practices that decrease energy consumption, waste, and pollution. And that's what we've been doing since then. More than a decade of work and resource development. We have worked closely with our partners, especially the Catholic Climate Covenant and Healthcare Without Harm. Some of our offerings have included prayers, videos, and reflections that highlight the moral and ethical importance of this work and its connection to our faith. Annual Earth Day resources and webinars, our Feast of St. Francis resources and webinar, and substantial materials on Laudato Si and connecting its message to healthcare and the common good. Invitations to collaborate with national groups, such as the Catholic Climate Covenant and Healthcare Without Harm, are also leading the way to address climate change and pollution. But most importantly, we have been a part of an effort to help healthcare organizations become critical community partners to address the social and environmental conditions that are making people sick in the first place. As anchor institutions in our communities, healthcare organizations have the capacity, the credibility, and the influence to push for changes to entrenched processes, laws, and special interests that harm the environment, especially those felt by low-income and minority communities. Earlier this year, spurred by the disproportionate impact of COVID-19 on minority communities and the racial justice protests of the last year, CHA announced a new initiative to address racism and to achieve health equity. Part of this effort, known as We Are Called, includes a focus on environmental justice. We, as a ministry, can raise awareness about how low-income and minority communities have been disproportionately burdened by the effects of pesticides, toxic industries, and hazardous waste, and how Catholic healthcare and others can respond. CHA has already hosted one environmental justice-related event, a webinar, where we introduced attendees to Hilton, a leading figure in the battle for environmental justice on the Texas Gulf Coast. Living in Port Arthur, Texas, in the shadow of several polluting industries, Mr. Kelly used community organizing to work for environmental justice there and then elsewhere. Feedback from the webinar highlighted to us the lack of awareness about the connection between where waste and toxins are stored and proximity to communities of color. Our members understand that our healthcare ministry needs to be a leader in protecting the environment. As organizations devoted to healing and health, we're uniquely positioned to play this role. A good example of a Catholic hospital that has dedicated its entire operation to environmental stewardship is Dell Children's Hospital in Austin, Texas. Join me in watching a video that showcases their stewardship program.
We have an environmental sustainability program here at Dell Children's that spans over the last 12 years. And it goes back to St. Vincent de Paul and to Elizabeth Ann Seton, where they provided for their communities. They said, "We will waste not and want not." It really started looking at how we wanted to design the building. We worked with the City of Austin. We worked with our constructors, our design folks, our architects, to see what we could do to exceed the standards of the U.S. Green Building Council. And now we are double LEED Platinum certified. We recycle just about everything you can imagine here, from the light bulbs to batteries to printer cartridges. The flooring here is made from recycled materials. We have a solar panel farm on top of 2 of our towers, and we're getting ready to build an additional medical office building where we'll have solar panel utilization as well. So over 75% of the energy in this building is fueled from that solar power. And we're not only a place for sustainability, we're a home to a lot of our children and their families for both short stays and long stays in the organization. This is a journey that our families and their children are walking alongside us to promote their health and to manage their oftentimes chronic illnesses. And we pride ourselves as being part of that work to make our children in our community and outside our community now to be the healthiest that they can be. They're able to get away from the bedside. They're able to get out of their care rooms and enjoy the outdoors, enjoy the gardens, enjoy the water features, enjoy the artwork within the organization. We are looking to our next generation and our next generation to still be here providing the highest quality care, but in a way that really takes the environment into consideration. I want their kids and their kids to be able to live in this sort of legacy organization where they're getting the highest quality treatment, but also are looking at sustainability to ensure that that healthcare is provided in the best way. We are really working very hard to continue that tradition of not only the daughters, but of Catholic heritage.
Dell Children's is a shining example of how healthcare facilities can best steward resources and be beacons in their community. CHA serves as a clearinghouse for environmental policies and programs. We convene our members regularly to discuss common challenges and also use meetings and our award-winning publications to share their programming and success stories. We advocate on the national level and sign the Catholic Climate Covenant policy positions. We also address the environment through reflective and formative resources. We produce reflection videos and so many additional resources that share the messages from Catholic social teaching. Here are a few of the Season of Creation social media offerings we developed and shared for all to use. the Catholic Health Ministry is committed to faithfully healing the earth. We join you in the Church's call to care for creation. As I conclude, I thank you for your time and ask that you please join me in watching one last video. It's a reflection on our collective call to be faithful stewards of God's creation.